Any name of the diseases? I'll be speaking exactly from the exam point of view, the points that you have to write. So what are the two most important diseases? If examiner asks you what are the two diseases that you know of from inflammatory bowel disease, what are you going to answer? One is Crohn's and the other is ulcerative colitis. Then you have indeterminate colitis, where you get features of both ulcerative and Crohn's, and some features of ulcerative, some features of Crohn's, and then colitis associated with neoplasia. Okay, so those two are not so important, but you should know about ulcerative colitis and Crohn's disease. I don't think you're going to get a main question on ulcerative colitis or Crohn's disease, highly unlikely, but they may ask you individually on ulcerative colitis or Crohn's disease. So what is ulcerative colitis? The basic pathology in ulcerative colitis or Crohn's disease is come in. Improper activation of the immune system. Okay. There is improper or inappropriate activation of the immune system. So this immune system plays a pivotal role in the pathology of ulcerative colitis and Crohn's disease. So it's a very age-old disease. The history dates back to antiquity, whatever it may be. It's a very age-old disease. If you search the literature, you can find diseases starting from the 15th or 16th century, whatever. So it's a chronic condition resulting from, it's a chronic condition, it's not an acute condition. It's a chronic condition. It takes many years to form. Okay, so it's a chronic condition which results from inappropriate activation of the immune system. So the two most important diseases that we cover are Crohn's and ulcerative colitis and Crohn's disease. Okay, now most important thing from your exam point of view, what examiner might ask you is, how do you differentiate between ulcerative colitis and Crohn's disease? There are many identifying features, but start with the gross, that means the location. What is the most common site of ulcerative colitis and what is the most common site of Crohn's disease? If you have studied about Crohn's disease, it's known as a skip lesion. Crohn's disease is known as, the type of lesion you get in Crohn's disease is skip lesion. What is meant by skip lesions? Suppose if this is an intestine, okay. You may not get a continuous involvement. So this is the involved area. And this is the uninvolved area. So this is known as a skip lesion. Huh? This is known as a skip lesion. Why hosepipe appearance happens? Huh? What has skip lesion to do with hosepipe? Huh? Nah, not exactly. Thick ho jay. Okay, hosepipe ta kirokom thick na? Thick ho jay. Then you get, this is Crohn's. See, this is, I'm explaining exactly from the exam point of view what the examiner might be asking you or what the examiner will be expecting from you, okay? And then you come to when you come to ulcerative colitis, you get a continuous involvement, predominantly affecting the large intestine, the rectum and the colon. Ulcerative colitis can occur in any part of the Crohn's disease can occur in any part of the GI tract. Crohn's disease can occur in any part of the GI tract. But the most common sites are terminal ileum, ileocecal valve, and cecum. They are common. Terminal ileum, ileocecal valve, and ileum are common. In 40% of the cases, only the small intestine is involved. Both small intestine and large intestine, predominantly the colon, in 30% of the cases, and the remainder 30%, only the large intestine, the colon. Rectum can also be involved. Okay. So, Crohn's disease, you get a skip lesion, means the entire colon is not involved. Entire intestine is not involved. It's skip. Involved, uninvolved. Involved, uninvolved, like that. Interspersed. Whereas in case of ulcerative colitis, this is ulcerative colitis. In ulcerative colitis, you get a continuous involvement, predominantly affecting the large intestine, the rectum and the colon. Very, very, very rarely the small intestine might be involved. Very rarely the small intestine may be involved. In case of extensive ulcerative colitis, there is involvement of the terminal ileum when it is called as backwash ileitis, but it's very rare. So when examiner asks you the location, please make a mention of this. Crohn's disease can involve any part of the gastrointestinal tract, but the most frequent sites of involvement include the terminal ileum, the end of ileum, which is at the junction with the large intestine, the terminal ileum, the ileocecal valve, and the cecum. These are the most common sites. The small intestine alone is involved in 40% of the cases. The small intestine and colon in another 30% of the cases, and the remainder 30% of the cases, only the large intestine. Okay, excuse me. Whereas ulcerative colitis predominantly involves the rectum, and it extends proximally up. It extends because rectum is down, so it extends proximally. Obviously, colon is proximal to the rectum. So it begins in the rectum right here. It begins in the rectum right here, and it extends proximally up to involve colon. Involve the colon, part of the colon or entire colon, whatever it may be. So no skip lesion. It's a continuous involvement in ulcerative colitis. Whereas in Crohn's disease, it's skip lesion. Remember these points. Very important. Remember this point. Exceptions are there, but I'm not going to go to exceptions. From your exam point of view, remember the location. Location is very important. Next comes, so this is the location basically. The same thing I have put. I don't think this should be a problem for you to understand. Crohn's disease is a transmural involvement, which I'll be coming later, whereas ulcerative colitis is predominantly involves the mucosa and the submucosa. That's all. So remember these points, remember this diagram. It's a beautiful diagram. I've taken it from the internet. This explains everything. Whatever I've written here, which is being depicted through a picture here in this slide. Okay, is this clear? I'm going to the next slide. So coming to the pathogenesis, just remember the names. This is more than enough for you. They will never ask you the pathogenesis of inflammatory bowel disease. Most likely, one is a hygiene hypothesis. What is a hygiene hypothesis? It's what is hygiene hypothesis? Where do you get Crohn's disease? Where do you get IBDs more? Which population? If you do a survey of the population, predominantly where? Middle Europe means what? What do you mean by Middle Europe? No, not Middle Europe, Northern Europe. Now tell me where? Not Middle Europe. It's not Central Europe. Northern Europe. Tell me. Scandinavia, Nordic countries. That is not Middle Europe. That's Northern Europe. Okay, so Scandinavian countries. Why? Because of the extreme hygiene that they maintain. What happens is, because of the hygiene, the luminal microbiota, they're not exposed to bad things. So sometimes they self-react inside the body. So that is one hygiene hypothesis. But now, because of refrigeration and improved food hygiene, even in third world countries, people are being affected by IBD. Then comes genetics. Just remember the one name of the gene is NOD, nucleotide oligomerization domain 2. It is most commonly seen in monozygotic and also dizygotic twins and all. So family members affected means there's every possibility of other family members being affected by IBD. So this is, genetics has a role in IBD. The third one is mucosal immune response. It's epithelial defects and mucosal immune response are more or less similar. If the person has some kind of epithelial defects, so what can cause these epithelial defects? Whether it's genetic factors or environmental factors like microorganisms, diet, infections, NSAIDs, whatever can cause an epithelial defect, this allows bacteria to get inside your lumen and cause an improper immune activation. So remember this point. One is hygiene hypothesis, two is the genetics, third is the epithelial barrier defect, which allows bacterial influx into the lumen, and then mucosal immune responses. So these are the things you remember, not very important from your exam point of view. So coming to the Crohn's disease morphology, straight away coming to the Crohn's disease morphology. Though I have written skip lesions initially, the first and foremost thing is ulcer. It begins with an aphthous ulcer. What is ulcer? How do you define ulcer? You have been to surgery. You have, how many days? 4 months over in surgery. At least you have done for 15, 20 days. So can you define an ulcer? Huh? Breach in the epithelium up to the what? What is the difference between erosion and ulceration? If I am correct, what my surgery professors told me, I didn't study after that. What is the difference between ulceration and erosion? What is erosion? What is ulceration? What happens in ulcer? If you look into the pathology, if you look into the slide, what happens in case of an ulceration? Ulceration can go up to the serosa. Very good answer. Ulceration can go up to the serosa. And pathologically, what is the hallmark of ulceration? Pathologically, what is the hallmark of ulceration? If I ask you, can anyone tell me what is the hallmark of ulceration pathologically? How do you know that this is an ulcer?
Ages, by the ages and the base.
Na ages based kotha hocche na. What happens if there is an ulcer? What happens next? How does the body react to it? Granulation tissue formation. So that's what, anyway, they may not ask you this question, but granulation tissue formation is the most important thing. Histological hallmark of ulceration. So the first and foremost thing is formation of these aphthous ulcers. Aphthous ulcers are very common in mouth. Aphthous ulcers. They're very common because of certain vitamin deficiencies. So ulceration is the most common. Beginning in ulceration is the starting point of a Crohn's disease. It begins with an aphthous ulcer. The ulcers are initially small. Then they coalesce to form large ulcers. They coalesce to form large serpentine ulcers, which are initially aligned to the long axis of the bowel. So the first and foremost thing is formation of an ulcer. These ulcers are initially small, but later these ulcers coalesce, they become large, serpentine in nature, and they are aligned along the long axis of the bowel. That also, after a while, they lose that configuration also. Number 2 is skip lesions. Skip lesions, I have explained you. You know what is a skip lesion. This is a typical example of a skip lesion. This is a typical example of a skip lesion. See, the red part is involved. This is uninvolved. Again, here it is involved. This part is involved. So this is typically an example of skip lesions. Involved versus uninvolved, which I have explained. Skip lesions is mostly it is a gross finding. Okay. Is this clear now? Ulcers and skip lesions are clear. Next coming to cobblestone appearance. What is meant by cobblestone? What is a cobblestone? You have all seen a cobblestone, right? What happens in case of a cobblestone? This diagram actually you will not be, even I could not appreciate much. If I show you this diagram, okay, let me draw this diagram for you. I think that will be easier for you to understand. So what happens here is, suppose this is the involved area, this is the uninvolved area. Involved versus uninvolved. So what happens in an involved area? A part of the intestine which has been involved by Crohn's disease, they are harboring the pathology. So the mucosa over there will be what? They will be destroyed. Because the mucosa will be destroyed, because the mucosa will be ulcerated, they will get depressed. They will get depressed. Whereas this part, which is involved, they will get what? Depressed. Whereas the uninvolved part, this is the involved region. Whereas the uninvolved region will be normal. So the mucosa will be somewhere like this. This is the involved area, whereas this is the uninvolved area. Again, this is the involved area, this is the uninvolved area. So this uneven configuration has been linked with the cobblestone. Is this clear? The involved area obviously will be depressed compared to the uninvolved area, which is healthy. Normal, depressed. Normal, it goes down, depressed. Right? Is this clear? Normal, depressed. Normal. So this has been linked with the cobblestone appearance. This has been linked with the cobblestone appearance. Clear? Is this clear? Yes or no? Should I explain this? Or this is clear? Should I explain this or this is clear? This is known as a... Oi, shunchis tora? This is known as a cobblestone appearance. Then comes stricture. Extensive areas of edema. Because of inflammation, there will be edema, submucosal fibrosis, hypertrophy of the muscularis propria. They will all cause thickening. They will all cause thickening of the wall. To a certain extent, it has been equated with the hose pipe. Finally, giving rise to what? Stricture of the lumen. This will give rise to what? The lumen will be fibrosed, converted into a narrow sac. That is known as strictures. Because of extensive fibrosis and all, at some point of time, it will be fibrosed like this, forming a, you know what is a stricture? Stricture, okay. And in case of extensive transmural disease, sometimes the mesenteric fat creeps over the serosal region. That is known as creeping fat. So remember this point, it begins with an aphthous ulcer, then there is formation of skip lesions, strictures, cobblestones, hosepipe appearance, creeping fat, and also fissures. Fissures form because of extensive ulceration and all. Fissures form between the loops of intestine, and it can extend up to the abdominal wall, perianal skin, vaginal wall, etc., etc. So these are the points that you must remember. Now, I have not explained anything inside. If you know the heading and if you read the book, I think that will be sufficient for you to understand. Remember, aphthous ulcer, skip lesions, cobblestone appearance, strictures, hosepipe, fissures, etc., etc. So again, creeping fat. In case of extensive transmural disease, there is creeping fat. The mesenteric fat creeps over the serosal surface. Okay. So this diagram may be tough. Now, if you compare a normal intestine, excuse me, to your left, and the intestine, the diseased intestine, to your right in case of a Crohn's disease, see, you can make out how much thick the walls over here is, and look at the cobblestone appearance. Then the fissures, and this particular thing, fat wrapping. Fat wrapping means what? This is creeping fat. This fat wrapping is nothing but creeping fat. Okay, so remember these points. If you need the slides, I'll give you. Some of you take it. So if you want, you can read from here. If you want, you can read from the book, or whatever it may be. Ultimately, once you see the slides from here, you have to go and study from the book. Okay, so this is basically Crohn's disease. So Crohn's disease, gross is over. Gross of Crohn's disease is over. Now I'm going to tell you the microscopy. Cryptitis and cryptabscess. What is cryptitis? What is cryptabscess? So the first and foremost thing is mucosal ulceration. The first and foremost thing is mucosal ulceration, which I explained to you. Aphthous ulcer, which coalesce to form larger ulcers. Mucosal ulceration, which will cause architectural distortion. If you compare this mucosal lining with this mucosal lining, do you think this is normal? Why? Because of extensive degeneration and regeneration, the crypts take on architectural bizarre shapes. Okay, they lose orientation to each other. Their shapes become very haphazard, and this is known as crypt distortion. So mucosal ulceration and architecture distortion means which architecture undergoes distortion? The architecture of the crypts undergo distortion. Next thing is epithelial metaplasia, gastric antral metaplasia. You generally don't get gastric glands in the stomach. You don't get gastric. What is Barrett's esophagus? What is Barrett's esophagus? Squamous epithelium converted to a columnar epithelium. Is columnar epithelium native to esophagus? No. Similarly, in stomach, in intestine, you don't get gastric glands. But here there is gastric antral metaplasia. There is, I'll show you a beautiful picture of cryptitis and crypt abscess when I talk about ulcerative colitis. So, epithelial metaplasia means it takes the form of gastric antral metaplasia, gastric antral glands. Normally, the gastric antral glands are not present in the small intestine, but here the cells undergo gastric antral metaplasia. Gastric antral glands are not found in the small intestine. Number third is Paneth cell metaplasia. Even Paneth cells are not generally found in the small intestine. Okay. This is important. The fourth one, non-caseating granulomas. Non-caseating granulomas, around 35 to 50% of the cases, not all, around 35 to 50% of the cases present with non-caseating granulomas. Remember, non-caseating. Caseating granuloma is hallmark of tuberculosis. Non-caseating granuloma you can get in various diseases. Recall your granuloma class when granuloma had been taught. I think all of you will answer sarcoidosis. It's very easy to answer sarcoidosis. But you must remember other diseases also. Syphilis, cat scratch disease, Crohn's disease. So Crohn's disease is very important. Non-caseating granuloma which you get in mesenteric lymph nodes. Sometimes you find cutaneous granulomas, means these nodules will be present in various parts of the skin. That is cutaneous granulomas. And that's when it is arbitrarily referred to as metastatic Crohn disease. Of course, this is not a tumor that will metastasize. But it has been, because the granuloma are found in various parts in your body and as nodules over the skin, this has been referred to as metastatic Crohn disease. But make sure this is not cancer. This is not cancer. Okay. And out of ulcerative colitis and Crohn disease, ulcerative colitis has a more propensity to form cancer. Okay. Adenocarcinoma of the colon. It's clear? Should I go to the next slide? So this is basically a case of Crohn disease. This crypt abscess means cryptitis, and see, you can make out these glands, they look quite normal. Whereas when you compare this gland, see how much architectural distortion has happened because of degeneration and regeneration. And the neutrophils that you get inside the crypts, this thing is called the crypts. And the neutrophils, when they accumulate in the lumen of the crypt, it's known as crypt abscess. I'm coming to cryptitis. There is a very good diagram. Okay, let me show you the diagram first. I think that will be better. So this is basically an example of cryptitis and crypt abscess. So cryptitis means the neutrophils are within the epithelial cells. The neutrophils are within the epithelial cells. They haven't come to the lumen yet. But once they cross the epithelial barrier and inside the lumen, that is when it is known as crypt abscess. So cryptitis and crypt abscess, just remember the names. Nobody will ever ask you what is a cryptitis. Shouldn't. I can't guarantee you, but if you know, it's better. If you can't remember, fine. Remember the important things. So cryptitis and crypt abscess, remember these points. Okay. So where I was, okay. So here you can make out the crypt abscess and architectural distortion which I have explained. What is this? What is this? What is this? Huh? Non-caseating granuloma. Yes, exactly. All of you have said. Very good. This is a typical non-caseating granuloma which is seen in Crohn's disease. Non-caseating granulomas are generally not seen in, because the ulcer is so deep. The regenerating mucosa bulges to such an extent that they give an appearance of a pseudo-polyp, not an original polyp. That's why it's called pseudo, false polyp. So this is basically a pseudo-polyp. We have seen the ulceration is so deep that there will be formation. The bulging of the regenerating mucosa will give rise to what is known as a pseudo-polyp. It's not an original polyp. That's why it looks like a polyp because of its ulceration of the involved part, and the regenerating mucosa will bulge to such an extent that it gives rise to a pseudo-polyp. It looks like a polyp, it is not a polyp. So it is small. Okay. The tip of these pseudopolyps they fuse with one another. The tips of these pseudopolyps they form polyps like this. The tips they fuse with one another, giving rise to what is known as mucosal ridges. The tips of these polyps fuse with one another, giving rise to what is known as mucosal ridges. Sometimes inflammatory infiltrates, if it is a severe ulcerative colitis, the inflammatory infiltrate can destroy the neuromuscular bundle of the muscularis propria, giving rise to what is known as toxic dilation of the colon, toxic megacolon. Toxic megacolon. Have you heard of a disease called Crohn?
হ্যাঁ হাসপাতাল
Have you heard of it? Really affects the okay, so this is toxic megacolon. Inflammatory infiltrate will destroy the neuromuscular bundle, giving rise to what is known as a toxic megacolon. So in ulcerative colitis, the involved mucosa, this is the uninvolved mucosa, which is yellowish, and this is the involved mucosa. The involved mucosa will be extremely red, granular, and fragile in nature. Extremely red, granular, and fragile in nature. If you look at the mucosa over here, this part is not involved, while this part is involved. Maybe this is up to this part. So this is basically the junction of the involved and uninvolved area. And compare the uninvolved area with the involved area. The involved area is extremely red, fragile, and granular in appearance. Okay. So coming to the microscopy again, crypt abscess and crypt distortion. Crypt distortion, crypt abscess, which are explained in epithelial metaplasia, are similar to this is cryptitis and crypt abscess. I'm showing you the picture once again. So crypt distortion, just like Crohn's disease, crypt abscess, cryptitis, and epithelial metaplasia. Crohn's transmural involvement, whereas ulcerative colitis is extends up to the mucosa and the submucosa, not more than that generally. And mucosal atrophy, submucosal fibrosis, distorted mucosal architecture, these are all evidence of hip disease. These are all residual of hip disease. Just remember this point. So clinical features more or less similar to again this charismas, bloody diarrhea, abdominal pain, fever, vomiting, etc. These are quite similar to ulcerative colitis. These are quite similar to Crohn's disease. Okay. Smoking virtually within the similar. So again the complications, these are the expected from both. So these are the various complications. Colorectal carcinoma would have underlying head. This is the complication of ulcerative colitis. It can be traced to colorectal carcinoma, predominantly adenocarcinoma of the colon, and the rest are more or less similar. So you have some intestinal manifestations, extraintestinal manifestations. The extraintestinal manifestations include uveitis, sacroiliitis, ankylosing spondylitis, sclerosing cholangitis, pericholangitis, etc. Depending on which organ is involved, and multiple organs may be involved at the same time. So these are the key points of ulcerative. I'm explaining them to you. You know the points now, or you have to read the books. These are the key points to distinguish ulcerative colitis and Crohn's disease. So this is in a nutshell what is ulcerative colitis, what is Crohn's disease. If you remember the diagram, I always remember diagrams, and that's how I teach. If you remember the diagrams, you'll be able to explain a lot of things. Just remember a lot of points. You can at least remember a lot of points. Okay, see that there's only findings of open story, the pseudopolyps and all. So these are the same things which I've explained. I've just given it in a nutshell in one picture. Then comes indeterminate colitis. Just remember the point. Indeterminate colitis means there is extensive pathology and clinical overlap between the two. We need ancillary tests to identify whether this is a case of ulcerative colitis or this is a case of Crohn's disease. Okay, so indeterminate colitis is nothing but when microscopic clinical features of the two diseases overlap, sometimes it becomes very difficult for us to straight away come to a diagnosis whether it is ulcerative colitis or Crohn's disease. Main thing, the microscopic feature is that of Crohn's disease, whereas the cross findings are that of ulcerative colitis. Okay, that's why we need certain ancillary tests to come to a diagnosis. And the last one, just remember colitis associated with Asia, which one is more common ulcerative colitis. So it depends on longer the duration of ulcerative colitis is, the longer the duration of inflammatory bowel disease is. For example, 8 to 10 years at least, the risk of colorectal carcinoma increases. Pancolitis, more than left-sided, means the entire colon is involved. If the entire colon is involved, the patient is at a risk. Greater frequency of this is an active inflammation. So remember this point, just at least don't remember this particular point, just remember the names. If you remember the names, that's more than sufficient. So now you know. Any questions?
Important organs for death. What are they? Bishop's tripod of life. If heart stops, then what we call it? Very good. Syncope. In terms of forensic, in terms of death. Lungs, asphyxia, and brain is coma. So these three make into, what are these three? These three organs are Bishop's tripod of life. এটাকে বলে tripod of death, Bichet. Mode of death. 3 modes of death. Okay? Now, what were the signs of death? 3 different types of signs of death. মনে আসছে কিছু? Okay. 3 different types of signs. What's a type of death? Somatic death. And after that, molecular death. In between, what is somatic and molecular death? মাঝখানে কি আছে? The period is called as supravital period. A quick recap. Class শুরু হবে একটু পরে. So, what are the signs of death? মনে পড়ছে? Immediate signs. Then, early signs. What are the early signs? Eye changes, lip changes, face changes, skin changes, along with algar mortis, rigor mortis, and livor mortis. Right? Acha, what is algar mortis? Huh? সেটা কি? Cooling of body. Cooling of body. ঠিক আছে? What is livor mortis? Livor mortis. Postmortem staining. পিছনে দাগ পড়ছিল লাল রঙের, মনে পড়ছে কিছু? থোড়া অল্প অল্প আইডিয়া আসছে তো? Okay. So these are early signs. Today's topic is late sign. Okay? So let's start the class. Late sign. Late sign of postmortem changes, that is after death, is decomposition. It has 2 processes, autolysis and putrefaction. So these processes goes parallelly. একটা শেষ হলে আরেকটা শুরু হবে না. After death, both of them start. কিছুক্ষণ আগে, কিছুক্ষণ পরে. Okay? Now, there is something called as taphonomy, which is study of decaying organism. And forensic taphonomy is the forensic process of decaying. Study of. Now, what is autolysis? Once the cell dies, the cell membrane becomes permeable. The cell membrane breaks down. Inside the cell membrane, that is inside the cytoplasm, there are proteolytic enzymes. Proteolytic, glycolytic and lipolytic. So these enzymes comes out into extracellular space. Now these lytic enzymes then breaks the other cells and tissues. This is how lysis happens. Now since this is an automatic process, so it is called as autolysis. Now point to remember that in this process there is no involvement of any bacteria or any other microorganism. So this process is called as aseptic chemical process. Okay? Now, So heat accelerates the process and cold slows down the process. Okay? Now the second process, putrefaction. Now what happens? All these cells are dying. The defense mechanism inside the body, there is no defense mechanism. So police nahi hai, army nahi hai. So bacteria have a free run. There will be less oxygen, more hydrogen ion, and there will be muscles, blood inside the blood vessels. All of this acts as nutrients for the bacteria. So bacteria will start growing. So this process of overgrowth of bacteria will start at 4 hours after death. ठीक है, 4 hours, and within 24 to 30 hours it will peak, and after that the bacterial growth will decrease. Okay, so 4 hours এখানে লেখা নেই, মেনশন করে নিই আমি স্লাইডে। 4 hours when bacterial growth starts, peaks at 20 to 30 hours, and then it drops. So these bacteria now ferment. So mostly anaerobic bacteria and mainly Clostridium welchi. How these bacteria enter? These bacteria enter through gut, that is GIT, then arteries, respiratory tract, genital tract, and if there is any open injury, then it will come through wounds. ঠিক আছে, আসছে কি? Okay. So now this is how the bacteria enter. Now bacteria spread with blood vessels. Now if there is staph and strep, then the process will fasten by 100x. ঠিক আছে? Now what happens to this Clostridium welchi? So Clostridium welchi secretes something called as lecithinase. It is an enzyme. It will hydrolyze lecithin. Lecithin কোথায় পাই? RBC cell membrane, and that will lead to hemolysis. So PM hemolysis, postmortem hemolysis, or PM is postmortem, and caused by Clostridium welchi through lecithinase. Now, in what is RIF? Any idea RIF? Huh? Huh? 4 factor? No, factor na. Right inguinal fossa. Okay, right inguinal fossa তে কি আছে? সার্জারি ক্লাস করেছিস তোরা? আচ্ছা, যারা যাদের গল্প করার ইচ্ছে তারা ক্যান্টিনে যেতে পারে, there is no problem. তোমার আমার অ্যাটেনশন ডেভিয়েট করে দিচ্ছি, ডাইভার্ট করে দিচ্ছি। হ্যাঁ, সাইড হয়ে গেছে সবার তো? সাইন হয়ে গেছে? সো ইফ নোবডি ইজ ইন্টারেস্টেড ইউ ক্যান লিভ, বিকজ আমার অ্যাটেনশন এদিক ওদিক চলে যাচ্ছে। এন্ড কি, হ্যাঁ, সার্জারি ক্লাস হয়েছে? অ্যাপেন্ডিক্স পড়েছিস? কে একজন অ্যাপেন্ডিক্স সার্জারি দেখছিল? কে? হু ইজ দ্যাট গাই? অ্যাবসেন্ট টুডে? আচ্ছা, ঠিক আছে, নো প্রবলেম। সো ওয়্যার ইজ অ্যাপেন্ডিক্স লোকেটেড? অ্যানাটমি তো বলেছিস। ম্যাকবার্নি পয়েন্ট। ওয়্যার ইজ ম্যাকবার্নি পয়েন্ট? ভাই কোন সেগমেন্টে আছে? এক্সাক্ট অ্যানাটমি জানতে চাইছি। রাইট ইনগুইনাল ফোসা, and exactly where? At the junction of which organs? Ileocecal. Everybody agrees with me? Ileocecal. There you will find a long appendix, right? So that cecum has bacteria. ঠিক আছে, সিকামে তোমার অনেক ব্যাকটেরিয়া থাকবে। Cecum is located superficially. So in this cecum, that is right inguinal fossa, there will be multiple bacteria. So these bacteria, what they do? They will produce sulfur, and then H2S. This H2S will combine with hemoglobin to form as sulfahemoglobin. Okay? So remember this name, sulfahemoglobin. And then deamination will happen. Along with this, deamination will happen, and at the end, ammonia, ferric, and phenylpyruvic acid will be produced. Now, mainly sulfahemoglobin, and along with these compounds, makes the color green. ঠিক আছে? So যদি তোমায় জিজ্ঞেস করে why the color is green, then your answer should be priority wise sulfahemoglobin. ঠিক আছে, কিছু কিছু আমি বইগুলো দেখলাম, তিনটে বইতে লেখা আছে sulfur hemoglobin is the only reason, and this is in our PG books. I just mention it here also. তো যদি তোমাকে অপশন দেওয়া হয়, the first priority should be sulfur hemoglobin. ঠিক আছে? So now right inguinal fossa, cecum, bacteria, they are making sulfur hemoglobin. Okay? So bacterial work starts at, এক্ষুনি বললাম কখন শুরু হচ্ছে ব্যাকটেরিয়াল অ্যাক্টিভিটি, আফটার ডেথ। আফটার ডেথ ব্যাকটেরিয়াল অ্যাক্টিভিটি স্টার্ট কখন হচ্ছে? আচ্ছা, আজকের ক্লাস কিন্তু ভেরি ইম্পর্টেন্ট, ইউ উইল নো ওয়াই, ইন টার্মস অফ এক্সাম অলসো, ইন টার্মস অফ রিয়েল লাইফ অলসো। ব্যাকটেরিয়াল অ্যাক্টিভিটি কখন শুরু হচ্ছে? এক্ষুনি বললাম, ও এক্ষুনি বললো 4 hours আফটার ডেথ। ঠিক আছে, ইট পিকস এট 20 to 30। ঠিক আছে, so by 4 hours we will have nice amount of bacteria in cecum, and they will start producing sulfur hemoglobin. ठीक है, and slowly cecum will color as green because color of sulfur hemoglobin is green. বোঝা গেল? Yes or no? Yes, bol bhai. So the external phenomenon that are important for us, external phenomenon, first or earliest change in case of decomposition, that is greenish discoloration in right inguinal fossa. Earliest sign in summer you will have at 12 to 18 hours, and in winter 36 hours. Okay, along with this what we will have is foul smell. So look here, এটা একটু লাইটের জন্য একটু ভয় আছে, বোঝা যাচ্ছে কি জায়গাটা একটু গ্রিনিশ দেখা যাচ্ছে? বোঝা যাচ্ছে? দেখা যাচ্ছে গ্রিনিশ? হ্যাঁ ভাই, লাস্ট বেঞ্চ। ফোনে কি দেখছো? হ্যালো, গ্রিনিশ দেখা যাচ্ছে? হ্যাঁ, কি রেডিশ? একটু দেখা যাচ্ছে বিকজ অফ লাইট। আচ্ছা, আস্তে আস্তে দিস গ্রিনিশ will spread over the abdomen and throughout the body. ঠিক আছে, সো এখানে দেখো, এখানে এক সাইডে দেখা যাচ্ছে রাইট ইকুইনাল ফোসা ফার্স্ট, মানে আর্লিয়েস্ট, তারপর লেফটেও দেখা যাচ্ছে। ওকে, তারপর আস্তে আস্তে পুরো বডিতে ছড়াবে। নাও হোয়াট হ্যাপেন্স ইজ দিস, 4 ঘন্টায় ব্যাকটেরিয়াল গ্রোথ শুরু হলো, গ্রিনিশ মানে সালফার হেমোগ্লোবিন প্রডিউস হওয়া শুরু হচ্ছে। স্লোলি দিস অ্যামাউন্ট ইজ ইনক্রিজিং, অ্যামাউন্ট অফ সালফার হেমোগ্লোবিন ইজ ইনক্রিজিং throughout the blood vessels, and thus the color of blood vessels will start changing. Slowly pink থেকে green, green থেকে greenish blue বা purple, then from greenish blue to greenish black, then black. This is natural progression of color change. Okay, now at around 36 hours what we will see, okay, this greenish discoloration একটু গ্রিনিশ ব্লুইশ হয়ে গেছে, সেটা আমরা পাবো where superficial veins of over the chest, over abdomen, over neck and over shoulders. So this gives এরকম দেখতে হয়, this kind of presentation, and this is called as marbling. What is it called? বলো, marbling. So now we have studied two changes. One is greenish discoloration of decomposition. First is greenish discoloration, second is marbling. When is happening, when marbling is happening? 36 to 48 hours. Okay, now skin changes, maceration পরে বলবো। From 36 to 48 we will have greenish bluish, তারপর 3 to 4 days we will have greenish blackish. ঠিক আছে, now foul smell, তাহলে ফাউল স্মেল কোথা থেকে আসে? So this reduction process happens and decarboxylation of amino acid happens. সেটা কি প্রডিউস করছে? কার্বন ডাইঅক্সাইড and something called as tomines. P is silent, তো tomines. So what are they? Cadaverine and putrescine. Okay, so these guys, cadaverine and putrescine, that are tomines, are responsible for the foul smell. আচ্ছা, স্মেলটা খুব বাজে কিন্তু। যদি তোমাদের কোনোদিনও সৌভাগ্য বা দুর্ভাগ্য হয়, হোয়াট এভার, তো গো ইন আ মর্গ অ্যান্ড সি পোস্টমর্টম, অ্যান্ড কোইন্সিডেন্টালি ইফ দেয়ার ইজ আ ডিকম্পোজড বডি যার পোস্টমর্টম হচ্ছে, তো নেভার 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 স্টার্ট পিকিং ওভার ইট। ঠিক আছে, আমার সঙ্গে এই এক্সপিরিয়েন্সটা হয়েছিল পিজির সময়। ফার্স্ট গেছি ওখানে, আমার বেশ ইন্টারেস্ট লেগেছে। পোস্টমর্টম এক্সামিনেশন হচ্ছে, এটা ডিকম্পোজ বডি ডাইসেক্ট করলো, দ্য এন্টায়ার স্মেল এন্টার্ড মাই nostril. So बाकी तो एक हफ्ता मजा आया बहुत. So that is why the smell is dangerous and it is bad, really really bad. Now these gases are non-inflammable, জ্বলবে না শুরুতে, but as I said ব্যাকটেরিয়া বাড়ছে 4 ঘন্টা থেকে 20 থেকে 30, there is enough time and then they are decreasing, but ওদের এফেক্ট কিন্তু 20 থেকে 30 আওয়ারে ডিক্রিজ করছে না, ওদের কোয়ান্টিটি ডিক্রিজ করছে, ওদের এফেক্ট কিন্তু আরো চলবে, because whatever production they had to do they did. So with more bacteria more H2S is produced. So with more H2S this non-inflammable gas becomes flammable. So this is very important. আগুন টাগুন লেগে যেতে পারে in case of while doing postmortem examination of a decomposed body. Absolutely clear? So which is what is causing the greenish discoloration in decomposition? And what are causing the smell in decomposition? What are they? Tomine. So এটা তোমার নিট পিজি কোশ্চেন দুটো হয়ে গেল। ওকে, now gas collects 12 to 18 hours in summer, 1 to 2 days in winter. আচ্ছা, what will happen if gas is collected inside the abdomen? Any idea? অ্যাবডোমেনের মধ্যে পুরো গ্যাস, কি হবে? হ্যাঁ, কি ফ্ল্যাটুলেন্স, ঠিক আছে, বাট লুক কি করে হবে? বাট উইল ইউ সে পাতলা হবে না ফুলে যাবে? ফুলে যাবে, টাইট হয়ে যাবে পুরো, হ্যাঁ। সো ক্যান উই কল ইট ব্লোটিং অফ অ্যাবডোমেন? সো দ্যাট মিনস 12 to 18 hours in summer we will have a bloated abdomen, টাইট হয়ে থাকবে একদম। ওকে, না এফেক্টস অফ গ্যাস, এই গ্যাস যখন অ্যাবডোমেনে ভরে যাচ্ছে, সো হোয়াট আর দে ডুইং টু দ্য ডায়াফ্রাম? ডায়াফ্রামকে আপওয়ার্ডে পুশ করবে। ওকে, সো ওয়ান্স ইট পুশেস, the amount of blood inside the lungs and heart, they get compressed and they will come out from nostrils and mouth. বোঝা গেল? Gas inside abdomen pushing the diaphragm up and blood accumulated inside the lungs and the heart will come out from nose and mouth. So they are called as PM purge. এই যে এখানটা একটা ছবি দেখা যাচ্ছে। So this is called as PM purge. Okay, so this is important. Why? কেন পুলিশরা তখন তোমাকে বলতে পারে, স্যার এখানে দেখুন রক্ত আছে, so there must be some injury. Okay, so this is not injury, দেখে নিতে হবে ইনজুরি আছে কিনা, but this is not injury, this is called as PM purge. So along with this, gas will also push out eyeballs from eye sockets, protruded eye, it will also push out the tongue. So tongue will be protruded out and clenched within the teeth. ঠিক আছে, এরকম লুক হবে। Now, so abdomen distended from 12 hours to 18 hours in summer and 1 to 2 days in winter. Now slowly crepitations, if you, আচ্ছা crepitation কো দেখেছিস এখন অবধি? কি এমফাইসেমার কেস পেয়েছিস? হ্যাঁ, পাবি যখন তখন দেখবি, বেশ ভালো লাগে। আচ্ছা, ওরকম ছোট ছোট ইলেকট্রিক বাল্বের যে কভারিং গুলো হয়, এরকম ফাটায় না তোকে? হ্যাঁ, so crepitations actually feel like that. If you have emphysema, a smoker যদি কেউ history of smoking, problem in respiration, then what do? You palpate here. আচ্ছা, বেশি palpate করো না, ক্যারোটিডটাকে আবার পুরো দিও না। So slowly palpate. If you feel something like that, so this is crepitation. In case of decomposition, you can also find crepitations. So subcutaneous tissue emphysematous within 24 to 48 hours. Now slowly blisters will form. এটা একটা blister, দেখা যাচ্ছে, বোঝা যাচ্ছে? হ্যাঁ, blisters, and of course these blisters will break and that will lead to slippage of skin বা slippage of epidermis. So blister formation at around 36 hours in summer and 48 hours in winter. So till now, the lips will be discolored and swelled. So till now, what are the signs of decomposition? Greenish discoloration. Okay, তারপর marbling, সিকোয়েন্স আমরা লাস্ট স্লাইডে দেখব। মার্বলিং, তারপর ডিস্টেনশন, স্মেল তো পাবে, সবসময় পাবে, ডিস্টেনশন, দেন আই প্রোট্রুডিং, টাং প্রোট্রুডিং, লিপ সোয়েলিং, দেন পার্জিং অ্যান্ড ব্লিস্টার্স। সো বেসিক্যালি চারটে তোমাকে পয়েন্ট করতে হবে, কেন ইউ হ্যাভ টু ওয়াই আই এম হ্যামারিং অন দিস পয়েন্টস? এনি গেস ওয়াই এসব ঘন্টা পরে কি হবে আমার? Any idea why are we hammering on it? Because we need to find out time since death. We need to find out time since death, and that is why each and every sign is important. আগের ক্লাসে মানে ডেথের ক্লাসে আমরা রাইগার মর্টিস দিয়ে টাইম সিন্স ডেথ বার করার চেষ্টা করেছিলাম, রিমেম্বার? অনেকে এসেছিলিস হয়তো, মনে পড়ছে একটু? সো নাও উই আর ট্রাইং টু ফাইন্ড ইট উইথ ডিকম্পোজিশন। তো গ্রিনিশ ডিসকালারেশন, মার্বলিং, অ্যাবডোমেন ডিস্টেনশন, ব্লিস্টার্স, 36 আওয়ার্স ব্লিস্টার্স। না হ্যাঁ, এই হচ্ছে পিএম পার্জ। আচ্ছা, এই যে এন্টায়ার ফোলাটা ফুলে আছে না মুখটা, হ্যাঁ, ইডিমেটাস, বা তুমি বলতে পারো এই এমফাইসিমা হয়ে পুরো ব্লোটিং, আমরা ইডিমা বলবো না, উই উইল কনসিডার ইট অ্যাজ ব্লোটিং আপ ফিচার্স অফ দি বডি। যখন আমরা লিখি তখন ব্লোটিং আপ ফিচার্স। ওকে, সো দিস ইজ PM purge, এটা কিন্তু কোনো ইনজুরি নয়, দিস ইজ PM purge coming out from nostrils and slowly going through head. কিন্তু পুলিশ might call it as injury. Now, so bloating of features, the entire feature will happen within 2 to 3 days. আচ্ছা, আমি অনেক পিকচার ডিলিট করে দিয়েছি বিকজ অফ পাবলিক থিং, দিয়ে ভাববো দেবো করে ডিলিট, মানে আমার করা রিসেন্ট পিকচারগুলো আমি ডিলিট করে দিয়েছি। সো ইন প্র্যাকটিক্যাল ক্লাস I might show you. ঠিক আছে, এগুলো পুরনো ইন দ্য সেন্স আমারই করা, বাট পুরনো। Now bloating features 2 to 3 days. Now dilation of anal canal and vagina will occur. Now through inguinal canal this gas will go into scrotum. So in case of males, scrotum will swell up and also breasts region will swell up. এত বেশি গ্যাস ঢুকবে, তো ইট উইল বি স্টিফেন্ড, মানে তোমার লেগ গুলো ফ্লেক্স থাকবে, হাতগুলো ফ্লেক্স থাকবে। ইট মাইট লুক, ইউ মাইট প্রিজিউম ইট ইজ দ্য বডি ইজ ইন রাইগার মর্টিস, বিকজ ইট উইল লুক লাইক দ্যাট, বাট ইজ ইট রাইগার মর্টিস অর ইজ ইট সামথিং এলস? আগের ক্লাসে বলেছিলাম ডিফারেন্সিয়াল ডায়াগনোসিস অফ রাইগার মর্টিস। এনি আইডিয়া? গ্যাস স্টিফেনিং, ডিউ টু গ্যাস ইজ অ্যাকুমুলেটিং ইনসাইড দ্য বডি এন্ড সব জায়গায় গ্যাস ঢুকে গেছে, দ্যাট ইজ ওয়াই দ্য বডি উইল বি স্টিফেন্ড। So this is called as gas stiffening. এখানে এই পিকচারটা অ্যাপ্রিশিয়েট করতে পারবি, হাতটা দেখ উঠে আছে, দেখিস লাগানো নেই কিন্তু নিচটা, এখানেও কিন্তু লাগানো নেই হাত, মানে এরকম উঠে আছে, এর পাটাও এরকম ভাবে উঠে আছে, মানে পিকচারটা নেই অবভিয়াসলি, বাট ইট ইজ দেয়ার, দ্য হোল পিকচার ইজ উইথ মি, সো আই saw it yesterday. So this is called as gas stiffening. The breasts are engorged due to gas. Okay. So swelling up of the entire body, and after that skin slippage will occur. Horror story হচ্ছে নাকি? Horror story. Now these guys, আচ্ছা এরকম ভাবে, এটা তো পিকচার, রিয়েল লাইফে দেখলে কি হবে? Okay, so these are called as maggots. So these are maggots, small or large in size. There can be maggot larva. So basically when we are looking for maggots, আচ্ছা এটাকে পোস্ট করিস না কিন্তু আবার, এনএমসি নতুন রুল বেরিয়েছে, হ্যাঁ দেখাও যাচ্ছে, হ্যাঁ তো কি বলছি, হ্যাঁ। সো when you are looking maggots, নেক্সট ক্লাসে আমরা ম্যাগট নিয়ে আবার পড়বো। ওকে, আচ্ছা বাই দ্য ওয়ে, ডায়াগ্রেসিং, কারা কারা নতুন লয়ের সম্বন্ধে শুনেছিস? নতুন ল আসছে শুনেছিস? সো क्या कर रहे हो? খালি ফেস্ট, খালি নাচলে হবে? জিনিসটা দেখবি যখন পাস করবে, পাস বলে তোরা নয়, পার্লামেন্ট, আইপিসি, সিআরপিসি এন্ড এভিডেন্স, ইন্ডিয়ান এভিডেন্স অ্যাক্ট will cease to exist. Good or bad, I don't know. Neutral in this case. Now, but the question is what will happen with you in your exam? That is the question. আশা করি কিছু হবে না, কেন এত তাড়াতাড়ি ইমপ্লিমেন্ট হয় না, তোরা পাস করে যাবে তারপর হবে, বাট থিংস আর চেঞ্জিং, তো ধারা বদল जाएगा, maybe. So now coming back to maggots. আচ্ছা, ধারা বদলানোর সঙ্গে সঙ্গে the home minister has announced something, home মানে অমিত শাহ, Mr. Amit Shah, that all these legal activities will increase and will be scientific in nature, and they are opening forensic colleges throughout the districts. Now what does this mean? This means today's class and next class will be very important. Why? Because these guys will be checked, maggots. That is why. So forensic is now becoming more scientific. মানে academically তো আগে থেকেই ছিল, but real life maybe. So these maggots can come within 1 to 2 days. Sizes and their life cycle কোনটা কখন থাকবে, that can also help you identify time since day. ওটা আমরা পরের ক্লাসে পড়ব, maggots life cycle. Now sphincter লুজ হলো, anal sphincter লুজ হলে কি হবে? স্টুল পাস হবে। ব্লাডার লুজ হলে কি হবে? ইউরিন পাস হবে। If there is wound, it will suddenly start bleeding, and after 2 to 3 days anal prolapse and uterine prolapse can be seen. যদি কোনো গর্ভবতী মা মারা যান, পেটে যদি বাচ্চা থাকে, so within 2 to 3 days the fetus or the baby inside the uterus can come out. So this will called as postmortem delivery, 2 to 3 days. Okay. Acha, what will happen to that baby? What will happen to the kilo? No, what I asked. What will happen to that baby? What do you think what will happen to that baby after 2 to 3 days mother died? Obviously it should be the natural thing. তো আমরা 99% probability নিয়ে বলতে পারি যে বেবি মারা গেছে, একটু দেখে দিতে পারি। So now what will happen to that baby? আচ্ছা, যদি বেবি কোনো মারা যায় intrauterine death, তাহলে where is the baby? Intrauterine death হলে where is the baby located? Intrauterine, inside uterus. Inside uterus where? Amniotic sac. So baby is surrounded with amniotic fluid. So now if decomposition happens, acha baby to mara geche okhane inside the intrauterine amniotic sac. So decomposition natural process, right? So what will happen? Autolysis, yeah, putrefaction. And of course when the baby dies it will come out. Autolysis. And this is called as, কেন ওখানে তো ইনফেকশন কিছু হচ্ছে না? Of course we have to bring it out, the mother উপর লাইফ রিস্ক হয়ে যায় if infection starts, right? Given the mother is alive, এই ক্ষেত্রে নয়, given the mother is alive, then this is called as maceration. So autolysis in case of dead born fetus is called as maceration. Details about maceration is very important. We will study in infanticide class. Now 3 to 5 days hair will start loosening. মানে তুমি যখন স্ক্যাল্প এক্সামিন করছো, হেয়ার যদি টানো, হেয়ার হাতে চলে আসবে খুলে। This is what it means. So when it happens? 3 to 5 days. Nail will be loosened. মানে টানলে বেরিয়ে আসবে। Okay. And more than 5 days, socket, teeth will be loosened. বেরিয়ে আসে না, বইতে লেখা আছে বেরিয়ে আসে, but I have never seen teeth বেরিয়ে আসে। ওটা বেরিয়ে আসতে গেলে তাকে ইন্টারভেনশন লাগে অনেক কিছু, টানতে হবে whatever, but the teeth will be loosened. Okay. Now in C, এটা হচ্ছে child. In case of child, the skull sutures will be disarticulated বা separated. Okay. So আমরা কি তাহলে পড়লাম? Signs of decomposition, মানে যেটা আমরা দেখে বুঝতে পারবো। এক হচ্ছে greenish discoloration, right? Distension of abdomen, right? Marbling, then PM pass তো ঠিক আছে, then blisters, bloating up of features, hair loosen, nail loosen, tooth socket loosen. Why I am hammering? Because এগুলো সব রিয়েল লাইফে তোমরা দেখবে যে डिकम्पोज बॉडी एशियन की पुलिस will ask, सर टाइम सिंस डेथ बताइए, टाइम बताइए, अरे कैसे बताए, ऐसा दिख रहा है, कैसे बताएंगे, इसके बिना पे बताएंगे. ओके, सो नाउ नेक्स्ट टपिक, पोस्टमॉर्टम लुमिनेसेंस. সো এখানে কি হয়, বেসিক্যালি পোস্টমর্টম বডি থেকে লাইট দেখা যায়, মনে হয় কিছু আছে লাইট জ্বলছে, দিস ইজ পোস্টমর্টম লুমিনেসেন্স. কারা কজ করে ইজ ভেরি ইম্পর্টেন্ট, ফাইটোব্যাকটেরিয়াম ফিশারি, লুমিনেসেন্ট ফাঙ্গাই আর ম্যালেরিয়া. আর ম্যালেরিয়া ইজ এ ফাঙ্গাই, হানি ফাঙ্গাই. ঠিক আছে, আচ্ছা পরীক্ষায় কি আছে এমসিকিউ, হোয়াট উইল কজ লাইটস ইন ডেড বডি, এরকম ভাবে একটা ভেগ টাইপের বলবে, মানে বেসিক্যালি দে আর আস্কিং পোস্টমর্টম লুমিনেসেন্স and they will give mercury, arsenic, copper, and then they will give R malaria, because R malaria is a মানে photobacterium fishery দিলে হয়তো খুব ফাইন্ড আউট করে নিতে পারবে, it is not that hard. luminescent fungi দিলেও luminescent শব্দটা আছে বলে that will not be hard, but R malaria বলে ये क्या है भाई, कोई poison होगा, so they will deviate it towards poison, but the answer will be R malaria, which is a fungi, a luminescent fungi. So this causes light in postmortem bodies. Now what is this? Distribution of decomposition. Decomposition কি করে ডিস্ট্রিবিউট হবে বডিতে, রাইট ইনগুইনাল, হ্যাঁ, তারপর অ্যাবডোমেন, আমরা ছবি থেকে দেখেছিলাম রাইট তারপর লেফট দেখেছিলাম তো ছবিটা আগে. সো ফ্রম দেয়ার অ্যাবডোমেন, অ্যাবডোমেনের পর চেস্ট, চেস্টের পর নেক, নেকের পর ফেস, ফেসের পর লেগস মানে থাই অ্যান্ড দেন স্লোলি ডাউনওয়ার্ডস, তারপর শোল্ডার অ্যান্ড তারপর আর্মস. নাও দিস ইজ when the body is lying supine in air. এয়ারে পড়ে আছে মানে কি, বডি খোলা হাওয়ার নিচে, খুলে আসমান के नीचे বডি হ্যাঁ, এয়ারে থাকার মানে এই, মানে হ্যাঁ 6 শোল্ডার, খুলে আসমান के नीचे বডি है, এয়ারে থাকা মানে হাওয়ায় ঝুলছে এরকম না. এয়ার মানে বডি, ধর এখানে এটা তো ঘরের মধ্যে হয়ে গেল, বাইরে যদি গ্রাউন্ডে বডি পড়ে থাকে দ্যাট উইল বি বডি ইন এয়ার, যদি জলের মধ্যে পড়ে থাকে বডি ইন ওয়াটার, যদি মাটি থেকে পুঁতে থাকে দেন বডি ইন আর্থ. ওকে, ইট ইজ ভেরি ইম্পর্টেন্ট, আমরা একটু পরে বুঝবো ভাই. এরপর যদি এই সুপাইন পজিশনে থাকে তো পোস্টমর্টম কি করছি ডিকম্পোজিশন, ডিকম্পোজিশন will happen in this manner. কিন্তু যদি কোনো পার্ট, ফর এক্সাম্পল বডি যদি মাথা নিচু হয়ে থাকে, দেন ডিকম্পোজিশন উইল স্টার্ট ইন দ্যাট ডিপেন্ডেন্ট পার্ট. ডিপেন্ডেন্ট পার্ট মানে কোনটা, হোয়াট ইজ ডিপেন্ডেন্ট পার্ট পড়েছিলাম, হ্যাঁ হার্ট লাংস করতে গিয়ে ডিপেন্ডেন্ট পার্ট পোস্টমর্টম শ্রেণীকে পড়েছিলাম, মনে আছে অভিষেক না কে ছিল আগের ক্লাসে, অর্ণব, where is অর্ণব, what was postmortem training look like, মনে পড়ছে কিছু পোস্টমর্টম ট্রেনিং, হ্যাঁ ওটাকে কি বলে, যেটাকে কি করে এক্সপ্লেইন করি আমরা পোস্টমর্টম ট্রেনিংটাকে, ইংলিশ প্লিজ, যে জায়গায় টাচ করছে ওকে টাচ করছে সেটাকে কি বলি, কন্ট্যাক্ট, কি বললি আরেকটা বল, প্যালার, কন্ট্যাক্ট প্যালার, আর পুরো ব্লাড যেখানে এসে পড়ছে সেটা হচ্ছে ডিপেন্ডেন্ট পার্ট. সো পোস্টমর্টম স্টেনিং will be seen on the dependent part, that is in this case dependent part will be what, shoulder, pelvis, right, কেন এটা মাটির উপরে লেখা আছে মাথা অবভিয়াসলি. সো দ্য ডিপেন্ডেন্ট পার্টে ব্লাড গুলো এসে জমা হচ্ছে, পোস্টমর্টম স্টেনিং আমরা পড়েছিলাম কন্ট্যাক্ট প্যালারে খালি ব্লাডটা থাকছে না, নাও দিস ব্লাড এখন ডিকম্পোজ হচ্ছে বডি কিন্তু, সো দিস ব্লাড থ্যাঙ্কস টু ব্যাকটেরিয়া উইল কনভার্ট টু সুলফা হেমোগ্লোবিন, রাইট, তার মানে তাহলে কি হচ্ছে, তাহলে দ্যাট উইল অলসো বিকাম গ্রিনিশ ডিসকালারেশন, দেন গ্রিনিশ ব্লু, গ্রিনিশ ব্ল্যাক এন্ড দেন ব্ল্যাক, ঠিক আছে, হ্যাঁ. সো ইফ দ্য হেড ইজ ইট ডিপেন্ডেন্ট পার্ট, then decomposition will happen first in head and then other part of the body. Colligative putrefaction, এটা আমার পিএম করা, আমি 2-3টে কেস এরকম পেয়েছিলাম. What is colligative decomposition? putrefaction, or also known as liquefactive putrefaction. What happens? The abdomen bursts out, chest bursts out after 5 to 10 days, and the organs will slowly turn into small friable mass black in color. Okay, একটা আমি body পেয়েছিলাম কালিম্পং while doing this, so that was in collocative putrefaction. Starts after 5 to 10 days, but that blackening thing will happen 1 মাস 3 সপ্তাহ মতো টাইম লাগবে 1 মাস. From that it will start happening like that. আস্তে 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 mass will be ছোট and then পঞ্চভূতে বিলীন হয়ে যাবে. Okay. And in case of children, chest also bursts out. Now internally, as I said, internally কি হবে? So আমরা তখন external পড়লাম. Now we move on to internal. Internally, first scattered patch. আচ্ছা, this will happen in organs. Every organ has its own time. कम ज़्यादा. Okay. But the process is same. तो जो भी तुम्हारा short note आशे, you can go with this, but stick to the exact findings which you will find in book. और कुछ मैं बोल दूँ. Now scattered patches. First, greenish yellow. From greenish yellow, greenish blue. From greenish blue to blackish green. And then black. अच्छा हमारा वही diagram टा मने आचे bacteria writing गुनल फोसा bacteria sulfahemoglobin H2S नीचे ferric, then ferrous and H2S ferrous sulfide. Okay, then black, greenish black থাকে almost black, কালো হয়ে যাবে body. আস্তে আস্তে the organs will be greasy and softened at first, and then of course they will turn black and small. Now internal phenomenon. 36 hours discoloration of inner surface of vessels. 36 আমরা কি পাচ্ছি আমরা আউটসাইডে রিপ্রেজেন্টেশন কি করছে 36 আওয়ারে আউটসাইড রিপ্রেজেন্টেশন কি হচ্ছিল মার্বেলিং এন্ড সি ইনসাইড মার্বেলিং হচ্ছে কেন ভেসেলস এর জন্য obviously the fair person marbling will be more visible. ठीक है, inside the vessels staining starts, discoloration of inner surface of the vessel starts. 36 to 48 hours clotted blood will be fluidish. ठीक है, 48 to 72 organs will start discoloring. কি process discolor করবে আগে যেটা বললাম yellowish green then black. And 5 to 10 days, we will have liquefactive putrefaction বা collocative putrefaction. You don't have to remember. এর থেকে তো আমার মামা is in pain, পাপা makes medicine ভালো, হ্যাঁ কি না? হ্যাঁ, so হ্যাঁ ওটা forget this mnemonic. I have something better for you. এটা আমার যখন আমি বর্ধমানে ক্লাস নিয়েছিলাম তখন এটা ওখানকার পিপিটি আমি আস্তে আস্তে রোজ এক ক্লাসের আগে অ্যাড করি একটু বেসিক পিপিটি ফ্রম দ্যাট টাইম কিছু কিছু অ্যাড করি টু ফরগেট দিস বাট আমরা একটু আন্ডারস্ট্যান্ড করার চেষ্টা করব টাইমস পিরিয়ড অফ অর্গান যেটা কিনা ডিকম্পোজ হচ্ছে ঠিক আছে সো not first but larynx and trachea will start decomposing at 12 to 24 hours okay winter 2 to 3 days stomach and intestine 24 to 36 hours spleen 1 to 2 days last organ it is important MCQ term prostate in males and uterus in females and of course bones in both will last to decompose. Now liver, how will liver look? So first soft and যখন postmortem করবে see generally postmortem কে তোমাকে সব অর্গানই দেখতে হয় but liver will occupy lot of space right so যখনই abdomen dissect করবে the first organ that will come is liver and you have to dissect it certain pattern so liver is very important first 12 থেকে 24 ঘন্টার মধ্যে after death the normal architecture the normal consistency will change into soft and flabby আর একটু লিভারটা গ্রিনিশ হওয়া ইয়েলোইশ হওয়া শুরু করবে after that due to accumulation of gas multiple blisters will form within 24 to 36 hours আস্তে আস্তে গ্যাস ভরতে ভরতে গ্যাসটা ফেটে যাবে। সো হোয়াট উইল হ্যাপেন, হানিকুম লিভার, foamy appearance বা vesicular appearance of the liver will be seen. এই সময় আস্তে আস্তে কালার will change to darker, মানে একটু ব্লুইশ বা পার্পলিশ লাগতে পারে, and from then slowly black হয়ে যাবে, then discoloration and then blackening. So this is the change of liver decomposition. Now intestine, stomach and intestine. 24 to 36 hours in summer and 2 to 3 days in winter. Dark red irregular patches on the stomach. Point to be noted, mucosa-তে কিন্তু multiple petechial hemorrhagic spots stomach-এ থাকতে পারে. Any idea what are the reason? Multiple injury stomach কেন হতে পারে? Guess work. Any stomach-এর মধ্যে postmortem করছি, আমি অনেক ইনজুরি দেখলাম, that is represented in the form of petechial spots. Why or what can injure stomach? হেমারেজ। ওকে ফাইন, কি হেমারেজ ব্যথা থাকে জিজ্ঞেস করলে? হ্যাঁ, কার জন্য? আচ্ছা, কগুলো প্যাথি, ঠিক আছে, ওকে, নেক্রোসিস বলছি, ঠিক আছে, গুড। এনিথিং এলস? কিছু সাবস্টেন্স খেলাম, কমনলি কি হতে পারে? কমনলি স্টমাক লাইনিং ক্যান বি ডিস্ট্রয়েড ডিউ টু অ্যাসিড বা পয়জন। পয়জন খাएंगे জায়গা তো মুছেই স্টমাকে যাবে, তো দ্যাট ক্যান হ্যাপেন। অ্যালকোহল ইনটেক, জীবিতদের মধ্যে অ্যালকোহল ইনটেক কিন্তু ক্যান কজ দিস থিংস অ্যান্ড দেন ইট উইল পারফোরেট। সো ইট ইজ ভেরি ইম্পর্টেন্ট টু ডিফারেন্সিয়েট ডার্ক রেড ইরেগুলার প্যাচেস with multiple small petechial spots because it does not look same, but differentiate কিন্তু প্রবলেম হতে পারে দেখে। আস্তে আস্তে দেখলে বোঝা যায়, বাট ফার্স্ট দেখে অলরেডি সবই তো সেম লাগছে। সো হোয়াট উইল বি দ্য চেঞ্জ? গ্যাস উইল বি দ্য চেঞ্জ। ইন কেস অফ স্টমাক অলসো, submucosal layer, gas will come and the bleb will form. কি করে বুঝবি? cystic appearance of the stomach will happen. তো আস্তে আস্তে stomach will also become soft pulpy mass and then greenish blackish discoloration. Intestine will coated with bile and blood. Skeletonization. Now এখনো অবধি আমি 5টা skeletonization-এর কেস করেছি in the small town of there. So what happens? Skeletonization, this is the last stage. Body will be reduced to skeleton 1 to 2 years later. Acha, any kind of wild animal, ants including, can help the process. So, acha, central to peripheral. These are head থেকে disarticulation শুরু হয় and central to peripheral disarticulate হয়. Okay. Now conditions affecting decomposition. So these are the conditions that will affect decomposition: external and internal. Air, clothing, manner of burial, moisture and temperature. Internal, age, condition of body, sex, male or female, cause of death. So these are the factors that will affect decomposition. Temperature, more, putrefaction, faster. Ask. Fat, more, putrefaction, faster. Moisture, more, putrefaction, faster. Compressed portion putrefies later. Now, important key. ধর কোনো part of the body, if the entire body is covered in a comforter বা warm clothing, তাহলে the entire body will putrefy faster. বুঝা গেল? Agree? যদি পুরো বডিটা কভার থাকে ওয়ার্ম ক্লোদিং দিয়ে, the body will putrefy faster. Why? Because heat accelerates putrefaction. এবার পুরো বডি নয়, জাস্ট হাতটা ধরে নো, হাতটা গরম জিনিস দিয়ে চাপা আছে, then the hand will only putrefy faster. The rest of the body will putrefy at a normal state. Then that means এইখানটা putrefy হচ্ছে, এত অবধি ঢাকা আছে, আর এইখানটা নর্মালি হচ্ছে। There is a demarcation. So there will be a demarcating line. A strict demarcating line will be there, differentiating the part of the body which is putrefying faster, or the part of the body which is putrefying later or in a normal state. এরপর ধর কোনো কেউ মারা গেল যে বেল্ট পরেছিল, then that pelvic region যেখানে বেল্টে থাকে, that will appear to be normal when the rest of the body is decomposed. Why? Because it was a compressed position. আর compress হলে কি হবে? ব্লাডটা চলে যাবে ওখান থেকে, and maybe that is the reason why it is maybe decomposes late. Now poisons destroyed due to putrefaction. Uncle Sam জানিস তো কে? হ্যাঁ, আঙ্কেল স্যাম জানিস? আমেরিকা, আঙ্কেল স্যাম, never mind. America is getting destroyed, so let it be poisons getting destroyed. Sam is mnemonic টা মনে রাখার জন্য, Sam is succinylcholine, aconite and morphine. Now poisons appears due to putrefaction, but we will have carbolic acid, carbon monoxide, alcohol, bromine, phenol. So these are the photon units for it. Poisons delaying putrefaction. C, mnemonic. Carbolic, chronic, heavy metal, and chloride, zinc chloride. Now Casper's dictum, very important. Casper's dictum. Casper's dictum states that a body will putrefy twice when it is in air than in water. Hello, question. Body will putrefy twice in air than in water, and 8 times in air than in earth. মানে কি? মানে বডি যদি জলে থাকে আর স্থলে থাকে, স্থল বলতে এয়ার, which one will putrefy faster? না, এটা তো কনফিউজিং, দ্যাট ইজ ওয়াই আই সেড ভালো করে স্যার। আচ্ছা, আর যদি বডি মাটির নিচে পুঁতে থাকে আর এখানে পড়ে এয়ারে পড়ে আছে, তাহলে কোনটা পিউট্রিফাই আগে করবে? এয়ার। ঠিক আছে, ওয়ান ইজ এয়ারে যত থাকুক, এয়ারে 8 টাইমস আগে হবে যদি পুঁতে রাখে কেউ, আর এয়ারে 2 টাইমস আগে হবে যদি জলে থাকে। আচ্ছা, পুঁতে থাকা ইজ লেস কমন, জলে পড়া ইজ মোর কমন, বিকজ পিপল ডাই উইথ ড্রাউনিং। নাও জলে পড়লে stagnant water putrefaction will be less slower, faster, and running water putrefaction will be slower. যদি ক্লিন ওয়াটারে থাকে putrefaction will be slower than in sewage. Sewage obviously এত ব্যাকটেরিয়া থাকবে, so sewage will putrefy faster. So this is Casper's dictum. Okay, আচ্ছা, যখন বডিকে জল থেকে বার করা হলো, then the putrefaction process will fasten. ঠিক আছে? So MLI of putrefaction, time since death, cause of death can be, never mind, infanticide, poisons, and Ray Gates test. Ray Gates is a hydrostatic test, আমরা infanticide এ পড়ব। Now adipocere formation. Gradual hydrolysis and hydrogenation of pre-existing fatty acids, that is oleic acid, which then combines with calcium and ammonia, becomes insoluble soaps. So these soaps are acidic and inhibits putrefactive bacteria. So putrefaction একটু ডিলেতে হবে। ডিহাইড্রেটেড বডি ঠিক আছে পাওয়া যায়, এটা একটা মডেল, কিন্তু আমি রিয়েল লাইফে একটা দেখেছিলাম, কিন্তু আনফরচুনেটলি আই ওয়াজ ডুইং দ্য পোস্টমর্টম, সো আই কুড নট ক্লিক দ্য পিকচার। তো খুব কম দেখা যায়, বাট দেখা যায়। সো দিস আর মডিফিকেশন অফ ডিকম্পোজিশন। ওকে, 3 weeks in summer in case of, so how will it look? Friable, crumbly, grayish white, brown projections, এরকম এরকম দেখা যাবে। ওকে, আচ্ছা, when the temperature is humid, then this can happen. Mummification, Egyptophoresis mummify body. So if, how will it look? Brittle, contracted, dried skin. Features are well preserved, injuries are well preserved. Acha, in both these cases, adipocere and mummification. Both of them are modifications of decomposition. Okay, both of them features, clinical features will be preserved. মানে cause of death can be identified. Cause of death ছাড় মানুষটাকে can be identified. কারণ ডিকম্পোজিশনের পিকচার থেকে তো বুঝতে পারলি যে মানুষটাকে আইডেন্টিফাই করা চাপ। Yes or no? Do you agree with me? যদি ব্লোটিং হয়ে থাকে ফেসে, will it be difficult to identify the person or not? It will. In case of mummification and in case of adipocere, identification of the body will not be a problem. Identification of the injuries will not be a problem. In case of mummification, time since death can be ascertained properly. কিন্তু adipocere ফর্মেশনের ক্ষেত্রে আমরা কিন্তু ট্রাস্ট করতে পারি না time since death estimation-টাকে. This is the only difference. And of course, the humid and the environment part, that is this. Summer ক্ষেত্রে এটা বেশি হবে mummified body. Now we come to last part, the important part. এটা হচ্ছে time since death বার করার একটা চার্ট. Okay, not exactly how it looks, but it can help. In summer, what happens? This is 0, 6 hours, 12 hours. বোঝা যাচ্ছে time after death. Okay, the lower axis, time after death. মরার পর কি সাইন দেখবো? Signs, death, signs of death. First sign to be seen. তিনটে সাইন বলেছিলাম, groups of sign. So first is immediate. Immediate দেখবো এই সময়, right? After that, early. What were the early signs? তিনটে কথা বল। চোখ আছে, ঠিক আছে, rigor mortis, algor mortis, liver mortis. Now muscles. Muscles এর first changes, relaxation, right? Relaxation of muscles. Muscle আমরা দুটো ক্লাসে মার্চ করছি। Muscles এর তিনটে চেঞ্জ, postmortem change. First relaxation, then contraction, that is rigor mortis, then relaxation, secondary relaxation. So first primary relaxation 2 to 3, but আমরা 1 ঘন্টা ধরে নিচ্ছি। Okay, now rigor mortis কখন ফর্ম করে? How long it takes to enter body? 12 ঘন্টা। 12 ঘন্টা দিয়ে ফর্ম করবে, টপ টু ডাউন। 12 ঘন্টা থাকবে, 12 ঘন্টা টপ টু ডাউন যাবে, যেইভাবে এসেছিল সেইভাবেই যাবে। আন্ডারস্ট্যান্ডেবল? সো দিস ইজ রাইগার মোটিস। 12 ঘন্টা ধরে এলো, 1 ঘন্টা আমি পিছিয়ে রাখলাম, 12 ঘন্টা ধরে থাকলো, 12 ঘন্টা পর পড়লো, মানে 36 hours normally rigor mortis should leave the body and the muscles in the body should be secondary relaxation. এবার আমরা ডিকম্পোজিশন কি কি পড়লাম? ফার্স্ট সাইন টু কাম ইজ গ্রিনিশ ডিসকালারেশন। টাইম কারো মনে আছে না? 12 to 18 hours. Summer 12 to 18 hours. Second sign, bloating, hey na, abdomen distension, 12 to 18 hours. Third sign, marbling, age and time 36 hours, right? তারপর বল just not exactly, huh? Bloating, entire body, আচ্ছা blisters 36 hours, right? Right inguinal fossa greenish discoloration, abdomen distension 12 to 18 hours. তারপর 36 hours marbling, এটা হচ্ছে blisters, দাঁড়িয়ে আরেকটা আছে blisters. 48 to 72 hours is bloating of features. Now 3 days to 4 days we will have what? 3 days to 5 days, but 3 থেকে শুরু করলাম। আচ্ছা, পুরোটা তো পুট্রিফ্যাকশন হচ্ছে। হ্যাঁ ভাই, ক্লাস করার পরে এই অবস্থা কেন? ওকে, 3 days to 5 days, but we'll have hair fall out, nail fall out, right? মানে এটা যা পেয়েছি আর I don't find nails, so female nails and stylish boy hair. And 5 days to 10 days, dark. Huh? collicutive, 5 to 10 days, we will have, more than 5 months, dark. Teeth will be loosening. And post 10 to 3 and then collicutive putrefaction. Collicutive necrosis আছে না pathology খালি necrosis মনে ছিল মুখে চলে আসছে. So these are the external signs. Internally 12 থেকে 18 ঘন্টার মধ্যে ট্র্যাকিয়া আইকন পাইনি বলে এটাই পেয়েছি, জাস্ট ট্র্যাকিয়া অ্যান্ড ল্যারিংস। দেন 24 থেকে 36 ঘন্টা স্টমাক, অ্যান্ড হিয়ার softening and flabby liver, blister formation, it honeycomb actually, honeycomb liver. So this is a মোটামুটি idea করতে পারো, and this can help you find identifying time since date up to 5 days onward, মানে 5 days obdi. After 5 days it will be difficult to find, can already body will be key in a collicutive putrefaction state. So this is in summer. Now in winter, rigor mortis holo. Now 36 hours in winter is greenish discoloration. Distension in 36 hours. Marbling happening in 48 hours. 3 days blisters and bloating. 4 to 5 days you will find hair falling, nail loosening and tooth loosening. And here, so 48 to 3 days, 2 থেকে 3 দিনের মধ্যে larynx trachea, 3 থেকে 4 দিনের মধ্যে stomach, and this, so 2 দিন পর থেকে in winter organs will start decomposition.
After critically evaluating about the drug. Interaction with pharmaceutical representative. How a doctor or clinician should interact with the pharmaceutical representative. Now, number one, very important, information about the drug. প্রথমে ড্রাগের সম্বন্ধে ইনফরমেশনটা নেব, কি ড্রাগে কি নাম রয়েছে, কিভাবে কাজ করে, কি ইন্ডিকেশন, কি কন্ট্রাইন্ডিকেশন। সো নেম অফ দ্য ড্রাগ ইজ ব্র্যান্ড নেম, generic name, approved generic name, or the international non-proprietary name. Dosage form and regimen, pharmacological action, mechanism of action, indication, contraindication, pharmacokinetics of the drug, adverse effects. If there is overdose of the drug, treatment of overdose. If there is any specific antidote is available for the drug or not. Like in case of morphine poisoning, there is naloxone. Warning, precaution and use in special population, basically in case of pregnancy, in lactation, or in the hepatic dysfunction patient, or in the renal failure patient. Drug interaction, very important. Then comes, we have gained knowledge about the newer drug or the existing drug. After that, why it is better than the existing drug which the drug is going on. Is it more efficacious, or it is more safer, less adverse effects, suitable dosage form? If the drug is available in a tablet or capsule form, it's very convenient to the patient to take the drug. So if the drug is in suitable dosage form, duration of action, if it's of longer duration of action, we can give the pill 1 or twice a day. That will be more convenient rather than to take the pill 3 or 4 times a day. So duration of action, adverse effect profile. If the drug is more safer, we definitely would prefer the newer drug. Interaction, if there is more drug interaction, so definitely the older drug we will be preferring, which has got lesser drug interaction. Convenience of administration, if the drug is being prescribed once or twice daily, so in that it will be more suitable than rather to take the drug for 3 to 4 times a day. Suitability for a particular group of patient, like if the drug is working in case of, we can administer the drug in case of pregnant lady or in the lactating mother, or in special population like in pediatric population, in geriatric population, whether the drug is indicated or not. And in case of hepatic dysfunction patient, renal failure patient. So we have to compare the newer drug with the existing drug. Why I am going to prescribe a newer drug if an existing drug is available? Price or cost, very important. The drug having the same action, same efficacy, same adverse effects profile, then why I would write the newer product which is more costlier than the existing drug. So, cheaper or costly compared to the existing drug of the same class of drug or drugs having same pharmacological action. Whether the price of the drug is justified as fixed by the pharmaceutical company or the cost is unusually very high, because writing a costly drug without any indication is extra burden to the patient. Exact place in therapeutics, where the drug is actually indicated, that should be known. The references of the drug for which the pharmaceutical company is claiming that it is more efficacious or it's more safer, we should look to the references also. The newer references where the drug is being shown as more efficacious or more safer. Others ask other informations as required by the doctor or the clinician. Take control of the discussion as many times as they keep telling about the drug in an extempore manner. Now, there are free samples which are being given by the pharmaceutical company to the doctor, and there are drugs available in the pharmacy also. Now, to assess clinical efficacy, do not use free samples, because the free sample may be of very good quality, although the drug available in the market may not be of such quality. So, to assess clinical efficacy, do not use free samples, but use actual drug available in medical stores and see the result of those drugs. This is because free samples may be of very good quality, while the drug available in market may not be of the same quality. That's all about it.